Well, good evening and welcome to the latest Instagram, Charles Chats Fertility. My name is Professor Charles Kingsland and I'm the Group Clinical Director of the Care Fertility Group, which is Britain's largest independent group dedicated to fertility care. My clinic is based in Liverpool on the docks, and my word was it rainy and cold there today. And I've left my two excellent colleagues, Sister Helen and our clinic manager Amanda, to switch the lights out and go and find their way home back to Manchester this evening. So be safe and take care on those roads. So we've got a few questions to answer tonight, and I'll try and get through as many as we possibly can. If we can't get to your question, then we will answer them by email or the next time. So just to let you know about what's happening to care over the festive period, if you're looking to start fertility treatment in the new year, you can get in touch with our patient inquiry team. They are working throughout the festive period, and you can ask them any questions. You can talk through your treatment, all the options available to you at Care, both now and in the new year. No question is out of bounds. It may be trivial. You may think it's trivial, but it's important to you. And if you feel that it's important, we're here to answer. We can also arrange appointments for you at your local care clinic, and we have 19 clinics throughout the United Kingdom. So there's one very close to you. So without further ado, we'll go on to the hottest topic, which is COVID, and great news that we've got light at the end of the tunnel. A vaccine is now available, so next year is going to be completely different. So I've got a few questions down here, starting with, is COVID causing any delays in starting treatment? Well, we're very lucky at Care because our clinics are dedicated to fertility and the vast majority are outside main hospitals. We have no delays, so that the treatment is continuing throughout the tiered system wherever you are. There are no delays to self-funded treatment. We're offering a full range of treatments, and in the first lockdown, we enhanced our safety to make sure that all our patients and our staff and our embryos are safe, with extra cleaning, social distancing, and although the majority of our consultations are still remote because we feel that that's safe for our patients, under exceptional circumstances, we can see patients face to face. If you're undergoing treatment, though, we need to ensure that the highest levels of safety are maintained. So at the moment, it's a little bit difficult to cater when you're having embryo transfers or egg collections for your partner to be there. It just makes sense at the moment. I know it's difficult, but it makes sense for to reduce the footfall through the clinics if at all possible. If you're having self-funded treatment, then you can just contact us via our patient inquiry team or directly to the local clinic, and there are no delays in treatment. You could reasonably expect to wait approximately 2 weeks from the time of your initial inquiry to your first consultation. The consultations last about an hour, and we have time for you. There are the clinics are arranged so that consultations are as long as you need them. When you, for those of you who have NHS funded treatment in Care Fertility, then the delay at the moment is securing the funding. As you know, the NHS is under severe pressure at the moment. So what we have to do is to inquire about your funding. to your local clinical commissioning group. Once the funding has been verified, then that goes back to the to the clinic where you're having treatment. And the process from the care point of view is then fairly rapid, and you would normally expect to wait probably about a month for your treatment to begin. Now, as I say, there is once that is funding is in place, because we're not restricted by other treatments going on in our clinics, then we can get rapidly through to your treatment. From the start to the end of treatment, it normally takes about 3 weeks from your first injection to the embryos going back. So the wait really is for the funding. Okay, what are the timings for treatment, and how long after my consultation will my treatment start? And then how long until I have the egg collection and then embryo transfer? Okay, so the majority of care clinics have a waiting time for initial appointments of less than 2 weeks. However, that depends on your location. Some care clinics have a longer waiting time. So call the patient inquiry team for the most up-to-date information at your local clinic. The treatment pathway, as I said before, is then fairly standard. You'll have your consultation, at which case all your treatment will be individualized for you. The treatment plan will be given to you, and we have a particular portal on our website where we can talk to you and send you the information that you need. Treatment will be planned around your cycle, and we normally start on day 1 of your cycle, and at that point you have your injections which stimulate the growth of your eggs, and that normally takes about 9 to 10 days. Once the follicles, these are the little fluid-filled sacs in which the eggs grow, have grown to a decent size, then you will have a late-night injection which completes the maturation of the eggs, and then 35 or so hours after that you have your egg collection. The egg collection is done under sedation, so you're not aware of any discomfort. It usually takes about 10 to 15 minutes. You then recover for an hour or so, make sure that you're feeling okay, and then you're well enough to go home. And it might be that you want to rest in bed for the afternoon, or maybe watch telly and have watched the latest episode in your Netflix series. In terms of taking time off, it may be that the following day you might not feel quite up to going to work or doing any chores or anything like that, so you might want to put your feet up. Then, of course, at the egg collection, your partner, or if you're having donor sperm, or if you're a single woman having a donor sperm, then the embryos are created using the sperm, and then they normally take about 4 to 5 days to grow and develop. Sometimes the embryos are put back on the 3rd day of development, but under most circumstances, the embryos are allowed to grow for 5 days. They're grown in a closed system, and in care we have this time-lapse technology, which is really great because the embryos are not disturbed, and we video the growth and development of the embryos and measure the growth, how they're growing, how quickly they divide, and all that information is put into an algorithm, a computer program, and the computer predicts which embryos are likely to turn into babies. And then on day 5, you re-attend the clinic for your embryo transfer. In many ways, the embryo transfer is the easiest part, but it's usually the most scariest because it's the part when your embryo goes back into your uterus. It's a bit like having a smear. A single embryo is put in a catheter, and then the doctor or the nurse practitioner will then very carefully put the embryo into your uterus. It's painless, could take about 5 to 10 minutes. And then after that, you get up, empty your bladder, and go home. Often people worry about getting up after an embryo transfer, or they feel as though they should lie down. Well, actually, there is no evidence to suggest that lying down or taking time off work improves your chance of getting pregnant. If you think about it, your embryo is the size of a sharp end of a pin. It will sit on the sharp end of a pin. So if you stand up after your embryo transfer, the embryo actually floats higher up. It's like a bubble in a bottle of pop. It floats up as you turn the bottle over. So as you stand up, the embryo goes further up. And if you've been asked to attend with a full bladder, which is often the most uncomfortable bit, the reason why we ask you to fill your bladder up is that actually presses down on the womb, so it straightens it and makes it technically easier to place the embryo where you want it to go. So when you get up and empty your bladder, it's actually, the bladder is below the embryo, so the embryo goes further up still. It's not as if you're going to wee the embryo out. And then what you do after that is do normal things. Don't go mad. Don't lie in bed for 2 weeks. But just be normal. And then, of course, you've got the 2 weeks of agonising wait for your positive pregnancy test. And I wish I could advise you as to what things help and don't help. But all I can say is just be positive, do normal things, and then with a bit of extra luck and a bit of magic, you get the result that you want. And we are there to help you if the result is positive, or if it's negative. We're there for scans, for advice, and we can support you all the way through. Okay, so me and my partner want to start fertility treatment in the new year, but I've been reading how long we should prepare, i.e. diet, before starting treatment. Should we book a consultation now for advice, or what should we do to spend a few months changing our diet and our lifestyle? Well, it's always a good idea if you're planning a family. It's always a good idea if you're not planning a family to be as healthy as you possibly can. So my advice to you would be, number one, very, very important. And if anybody's listened to my Instagrams before or my lectures, I say the same thing every time. Stop smoking, particularly if you're female. Smoking is so bad for your fertility. If there's one thing you could do this Christmas, stop smoking. Have a healthy, balanced diet. Protein, fruit, vegetables, vitamins, minerals. Anything that you can buy next to the till, next to the checkout at your local supermarket is probably not good for your fertility. Okay? Unfortunately, that's the case. Cut down on your alcohol. I can't imagine life without alcohol, so I'm not going to be hypocritical and say don't drink alcohol at all. But you can get by on drinking alcohol once or twice a week. 6 units, 4, 5, 6 units if you must. Caffeine, sometimes the data suggests you drink lots of caffeine, you drink no caffeine, but realistically, do you really think that everybody who drinks coffee has a fertility problem? No, just everything in moderation. Your body mass index is very important. Now, your body mass is your weight in kilograms over your height in meters squared. So it should be ideally between 30 and 35. If it's higher than that, as many patients have weight problems, then try your best to lose weight. And dieting is it's the great unknown. All you need to do with diet is cut out food. Okay, reduce your food intake. Don't forget, drinks can be very calorific. All these fizzy pops, no good for you. No good for your weight. So you can get information on our website. Gillian Lockwood, one of our very senior doctors in Tamworth, does lots of blogs on our website about weight. We have, fortunately, because Care is such a big organisation, we have many experts throughout the country who are well tuned to dietary advice, complementary therapy, diet and vitamin supplementation. Zeta West Clinic in London is one. There is nobody in the country who is more experienced in dietary or complementary therapy advice, and we in Care can call on that. So look out for the diets, look out for the blogs and the websites. It's a difficult time of the year to lose weight, but if you can, that's great. There is no reason why you shouldn't come and see a fertility doctor if you're overweight. Don't just say, "Well, I'm overweight, therefore I can't go and see the fertility doctor." If you have a weight problem, then don't sit at home worrying about it and saying, "Oh, I've got to lose weight before I could go to the fertility clinic." Come and see us. We can offer you that advice. And it doesn't mean to say that you can't get pregnant if you're overweight. It's just that your fertility is very, very closely related to weight. Body mass between 30 and 35 is ideal. And we all know people who are grossly overweight, who have children, but their fertility may have been much higher than ours when they started out, and their weight has reduced their fertility, but their fertility is still high. Okay. So good luck with diet. And as I said, don't, sit at home worrying about it. Come and see us and we're happy to help. What is Care's advice about the COVID vaccine and fertility treatment? Okay, so the thing about the vaccine is it is good. It's effective. People say, it's been rushed through, and it normally takes about 10 years to get a vaccine from inception to market. But what you have to remember about this COVID vaccine is there's been 10 times as many people working on it, 10 times as much money spent on it, based on knowledge that we already had. So, don't worry about the fact that it's been brought to market very, very quickly. There's been a lot of intensive investigations and appraisal of that vaccine. And most of these COVID vaccines are around 70% effective, which is good. That is effective enough. If you think about the flu vaccine is 50% effective. So it's better than the flu vaccine. Now, what we don't know about the vaccine is, though, it's what happens in pregnancy. It's not that it's dangerous, it's not that it's beneficial, it's just that we don't know. So our advice to you is that if you are pregnant or you are planning on a pregnancy, it's probably best not to have the vaccine, but take all the measures that you are normally doing to reduce your chance of infection. Social distancing, sanitizing, wearing a face mask, keeping yourself sensible. I mean, it's now we've been doing this for 9 months. It's a lot of things are just common sense. Keep away from areas where there might be a lot of people close together. Just be sensible. There's no advice against male partners having the vaccine. If you do have the vaccine, then really our advice would be you shouldn't get pregnant within 3 months of having the vaccine. But of course, it's your decision. It's a free country. You can have the vaccine if you want to. You don't have to have the vaccine. My advice to you would strongly be, get the vaccine, and let's get rid of this. Is it know if the COVID vaccine will have an effect on the unborn children in the future? We don't know. What we do know is it's highly unlikely. It doesn't cross the placenta. We can't say for certain, but it's like everything in life. It's like saying, does smoking have an effect? Well, I can almost guarantee you that smoking will have a bigger effect on the unborn child than the vaccine will. So everything is risks and benefits. But at the moment, the benefits of having the vaccine far outweigh the risks. And you're always going to see these conspiracy theories. But for me, it's like, why not have the measles vaccine? There are some women who do not, or some couples who will not use a measles vaccine. They don't realise that measles is a big killer of children. The thing about measles is, when I was a general practitioner, my old bosses used to say that you always know when a child has measles because they are profoundly miserable. And the reason they're miserable, why measles gives kids such misery, is because it causes an encephalitis. It inflames the brain, and it can cause long-term problems, far greater than any vaccine would. So you've just got to, in all things in life, you've got to weigh up the risks and the benefits. And the benefits of a vaccine outweigh the risks. It's just that we don't know what happens in pregnancy. So, why can't you start treatment if you're breastfeeding? I've heard other clinics allow it. Well, breastfeeding, the hormone that is released by your brain that brings down the milk from your breast is prolactin. And prolactin is a stress hormone, okay? And it has two other major side effects, prolactin. Number one, it brings down it creates breast milk. Number two, it stops ovulation. And number three, it thins the lining of the womb. So women who are effectively breastfeeding do not ovulate, do not release an egg, and do not menstruate. And for that reason, breastfeeding is the best contraceptive and the most widely used contraceptive in the world. And you do not want to have prolactin knocking around when you are trying for a baby. It will prevent you from getting pregnant naturally. So similarly, if you are breastfeeding, it is best not to embark on fertility treatment or try for another baby. If you're breastfeeding effectively, it's a good contraceptive. If you're coming to the end of breastfeeding and your periods are starting up, again, it must mean that your prolactin levels are coming down and your fertility hormones are coming back into function. But breastfeeding your child is a very, very beneficial thing to do. It confers oodles of benefits on your child. So I wouldn't necessarily stop breastfeeding to start expanding your family. Feed the child, finish your breastfeeding, start your fertility treatment. But for that reason, I'm very surprised that clinics allow you to undergo fertility treatment if and when you're breastfeeding, because they're counterintuitive. Just you can have one and not the other. Okay. How can I thicken my uterine lining before starting treatment? Should I wait to get a certain point before inquiring about IVF, or is this something I'll be advised about at my consultation treatment? In situations like that, it is always good to get the best advice. And the best advice will be in your fertility clinic, your local fertility clinic. And they will be able to spend the time to advise you on the morass of information that is out there on social media. Some of the information that I see is scary. So thickening the lining of the womb, I've heard of lots of things: vitamin E, pentoxifylline, certain gels, certain ointments, all with varying efficacy. I have to say, varying poor efficacy. The one thing that really thickens up endometrium better than anything else is estrogen. That's what it's designed to do. Part of the function of estrogen is to thicken the endometrium. But my advice to you is, if you are having problems with a thin endometrium, or you've been told your endometrium is not thickening up, because if it's not thick, then the embryo may not implant. Get specialist advice and get it sooner rather than later. And this is one of the things that I've said before, don't worry about it. If you've got a, an issue, you've got something that you're concerning you, get some specialist information. Right. Soya isoflavins. Do you have an opinion? Not really. Yeah. Do they help fertility? No comment. They don't do any harm, I suppose. Next one. Possible reasons for implantation issues. Had a failed FET. What's the first thing you check to diagnose? Well, if you've had a failed frozen embryo replacement cycle, which is very sad and disappointing, what you want to know is why you think that failed. Now, as a rule of thumb, we always think that women will always take it upon themselves to blame themselves. Well, it's something wrong with my womb. Was my endometrium too thin? The chances are it was something wrong with the embryo. In fact, over 80% of the problems of failed implantation lie with the embryo. Okay, so the best thing to do is, if your frozen embryo replacement cycle has failed, be kind to yourself. Don't jump to conclusions too early. Get over it, because it's important to grieve and get over the disappointment of failure. What you have to console yourself with, if you've got frozen embryos, that was a good sign. So the prognosis is not, the outlook is not that bad. If you've had a frozen embryo, then at some point the embryos that you've created have been good enough to freeze, but on this occasion may not have been good enough to turn into a baby. But what you need to do is to get the full information from your clinic. So the clinic who looked after your treatment, they will have all the information regarding your embryos, regarding your endometrium, how the embryo transfer went, and what are the likely the causes, and what are the likely remedies, because we can learn from frozen embryo replacement cycles and how we can improve them. At Care Fertility, we've got a lot of additional tests that we may think may be appropriate for you. And if it's, if you feel as though it's time for a change from your clinic, or you may feel as though you may have lost a bit of trust, well, get a second opinion. Get your notes, because they're your notes, and take them somewhere where you may feel, that a second opinion may be beneficial. And it may be that second opinion says, well, it's all been fine, and, stick with it. Or it may be that, there may be a different angle that you can look at, but don't lose hope. There's always an angle. Okay, we're getting lots and lots of messages here, so I think we're going to have too many. Are there any more questions here? Not really, but we'll please could you advise what could be the cause of losing so many embryos in the thaw? Well, it may be that the quality of the embryos that were thawed were just not of sufficient quality to thaw effectively. You need to know how they were thawed. Were they vitrified, or were they thawed in liquid nitrogen? In which case the thaw rates are different. But you need to ask your clinic why. The chances are, I would say, just from that one-off question, that it was probably because the embryos were just not of sufficient quality to have been frozen in the first place. But your clinic will answer those questions. Don't be backwards at coming forwards. They're your embryos. Find out what happened to them. Okay, so we've had lots of questions, and we will message you with the answers. Our new patient inquiry team, as I've said before, are available to answer all your generic questions throughout the Christmas period. Take a look at our website or our social media for our festive opening hours. This is our last Q&A Q&A of the year. So I would just like to say thank you for being so kind to us all at Care over the past year. It's been a really difficult time, particularly when you're trying for a baby. Be kind to each other. Very, very important. We don't just care. We care. We are Care. I want you to all to have a happy, healthy, a peaceful Christmas. As I said, be kind to yourselves. And with the vaccine and the light at the end of the tunnel, just imagine what next Christmas may look like for you. See you in the new year. One last question. Oh, thank you. And, well, thank you as well, PCOS TTC Yorkshire. Please could you advise... Oh, no, I think that's it. I think that's it. So we will see you in the new year, and stay well.